National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hey there, Naturopathic Doctor Jonathan Beatty here, health expert at Nationalnutrition.ca. Today we're going to talk about a disease that's close to my heart, Parkinson's disease. I had a family member who suffered from it, and so it's affected my life, and for that reason I'm very passionate about natural ways that you can help support and prevent Parkinson's disease. By the time that you're starting to see the symptoms, the disease has already progressed quite significantly, so it is very imperative, if you think you're starting to suffer from Parkinson's disease, that you do get immediate medical attention, because the earlier you get started with treatment, the more positive the outcomes are likely to be. Also, the earlier in your life that the symptoms onset, the more aggressive the disease tends to be. So again, the more important it is at a younger age that you do get evaluated immediately to make sure that what you're experiencing is actually Parkinson's, as some other diseases do prevent early on very similarly. So if you have symptoms, don't panic yet. It doesn't always necessarily mean it's Parkinson's disease. Parkinson's disease, it's essentially, we're looking at it as being genetically linked or a hereditary link, but it's a disease where you get a breakdown of a part of the brain that produces dopamine called the substantia nigra. And as this part of the brain breaks down and your body can't produce adequate dopamine, you start to develop a number of symptoms. The first symptom that's typically going to onset is a tremor or a trembling in the hands. And that's often considered the keynote symptom of Parkinson's disease. We call it the pill rolling tremor. And you'll often see people where their hand shakes back and forth in front of them like this at rest. And we call that pill rolling. And that's a very common symptom at early Parkinson's. And what's happening is at all times your nerves are firing, telling your muscles to fire and contract, and at the same time your nerves are firing, telling them to relax. And in Parkinson's disease, essentially you're losing that inhibition signal. So over time, the muscle's firing and it's causing it to tremor, and that's what creates a lot of the symptoms. Now, as this goes on, again, you're losing that inhibitory signal, so what you're going to start to develop is muscle rigidity. You start ending up with what they call a shuffling gait, so people lose their ability to walk, and oftentimes can even lose ability to swallow, and any other neurologically controlled system starts to break down, and you can get a variety of symptoms, and it's a very, very debilitating disease, and often associated with a lot of depression around it, because of course your mental faculties are there, your memory is there, your concentration is there. It's just your ability to move your body is impaired, and that tremor is present. And so of course that really dramatically affects quality of life. So this is why we want to intervene as quickly as possible, because what ultimately leads to the breakdown in that substantia nigra? One of the things that we've seen, lead poisoning. There are studies that show that intoxicants can actually damage the substantia nigra, preventing dopamine production, and then this leads to the development of Parkinson's over time. Any type of elevated oxidative stress in the brain can be problematic. Any type of intoxicant could damage the substantia nigra, and for that reason I often recommend patients do yearly detoxes just to prevent the accumulation of low-dose toxins that can slowly damage the substantia nigra over time. If you do have early symptoms, there's a couple of different things that you can supplement with to help your body manage it. Basically help try and slow down the damage to that substantia nigra, and to improve your body's ability to manufacture the neurotransmitters. So one of the first things you want to look at is an amino acid called phenylalanine. There's a small group of people that can't take it. If you have PKU, you should probably avoid this. But as long as you don't have PKU, phenylalanine is a great amino acid to supplement with to aid your body in the normal production of neurotransmitters and mitigate some of the symptoms of Parkinson's disease. As well, I also recommend typically supplementing with carnitine. Carnitine aids the body in using fat as fuel, and it also works as a very potent antioxidant, specifically in fat-soluble tissues, but it also again helps with the manufacture of energy in the mitochondria. And so of that little bit of substantia nigra that you have left, what you're trying to do is optimize its function. As that part of the brain is getting more and more damaged, what you're really trying to do is, extract every last piece of energy out of the remaining functional cells. You want to make sure those remaining functional cells are working optimally. And to do that, adding in some L-carnitine can be very effective. As well, I also recommend supplementing with omega-3s. Again, omega-3 fatty acids help to reduce inflammation in the brain. They're used to make up the membranes of the brain. So again, you're trying to manufacture healthy substantia nigra cells and reduce the development of the Parkinson's disease. So those are some of the more effective ways that you can help manage Parkinson's. Another interesting technique that we're starting to learn more and more about is exercise. Exercise seems to mitigate some of the symptoms, and I've actually seen a study where they had Parkinson's patients ride a bicycle. And people that had a lot of difficulty with walking, a lot of gait abnormalities, were able to get on an exercise bike, pedal it for a little while, and their symptoms when they got off would actually be alleviated for 10 to 15 minutes. And so that can be a very helpful therapy in just helping to minimize the symptoms and retain some of your normal function. So there's a lot of different physical therapies that can also be very important for Parkinsonism. So if you know you're predisposed to it or you suffer from Parkinsonism, I hope this helps. If you know somebody that may be predisposed or suffers from Parkinsonism, please share this with them. Check out more of our natural health videos, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.